I'm 48 and I can't sleep. This could be due to having perimenopausal or menopausal sleep issues. Having sleep disturbances or insomnia is very typically a first sign that usually brings patients into my surgeries. Here are a few hints and tips of what you can do to get a good night's sleep. Lack of sleep or insomnia is a symptom, not a diagnosis. So a healthcare professional should be investigating to find out the underlying cause of why you can't sleep. If it's likely that the range of symptoms that you're getting are perimenopausal or you're in the menopause, so 12 months without a period. When I see patients in my surgery, I start with these 4 tips. Sadly, there are no shortcuts. Start with a good sleep hygiene. Keep your bedroom cool, dark and quiet. Stick to a regular sleep schedule. No phones and devices. Bed is for sleep and sex. Regular exercise can help. Aim for at least 20 to 30 minutes most days, but avoid intense workouts close to bedtime. Number 3, try mindfulness and relaxation techniques. Deep breathing, meditation, and progressive muscle relaxation can calm your mind. Watch your diet. Avoid caffeine and heavy meals before bedtime. Herbal teas like chamomile can help. I get asked a lot about supplementations for menopausal sleep and if they will help, but I have to be completely honest, we don't have randomized controlled double-blind trials, and also there's no meta-analysis of all the trials that have been done on supplementation to show that they work. However, what I have done is listed some of the common supplementations that some of my patients have reported back to me to say that they've helped them, and also looking at the few studies that we have done to look at the effect of, say, magnesium, riboflavin, vitamin D, and evening primrose oil. You've got to be quite careful with magnesium. It really affects some people's gut, so particularly if it's not absorbing well, or if you've got Crohn's or celiac or irritable bowel syndrome, then you might find that the magnesium doesn't suit you very well. And equally, just be careful with vitamin D and interactions with other medications that you might be on. If you're thinking of taking supplementations in higher doses, it's always worth having a discussion with your doctor. Yes, systemic HRT does help with menopausal sleep disturbances. Remember, if you're replacing the estrogen and progesterone and the risks and the benefits are outweighed for each individual patient, usually I find that the benefits outweigh the risks, then it's a great way of managing hot flushes, night sweats, irritability, and also sleep disturbances as well. So let's look at how micronized progesterone helps with that. We have a lot of data now that shows that using micronized progesterone, such as utrogestan or Geprotix, can really help with sleep. Micronized progesterone influences sleep in the brain through its interaction with the brain's GABA receptors. Now, GABA is a neurotransmitter that promotes relaxation and sleep. Micronized progesterone enhances the effect of GABA by binding to these receptors, helping to calm the brain and promote a deeper, more restful sleep. Studies show that micronized progesterone, such as utrogestan like this, can improve sleep quality, reduce nighttime wakening, and help you feel more refreshed in the morning. Like anything, HRT is not a one-size-fits-all or a silver bullet for fixing all your sleep issues. If you choose to go on HRT, it can take 3 to 6 months for micronized progesterone to help with sleep alongside your holistic and lifestyle measures as well, which I mentioned earlier. For those who can't have HRT or choose not to go on it but are struggling with their menopausal sleep, the NICE guidance does offer some alternatives such as antidepressants such as sertraline or venlafaxine. There is some evidence to consider natural supplementations like melatonin or valerian root, but we don't have a lot of data to back that up for menopausal sleep. Studies do show that they can improve sleep quality. As always, consult your doctor first to make sure that there are no interactions with other medications that you may be on. Finally, something that I would recommend for everybody, cognitive behavioral therapy for insomnia. It's a highly effective therapy that can help you develop better sleep habits and address thoughts and behaviors that cause insomnia. It's a bit tricky getting it on the NHS, but there's a really handy guide on the womenshealthconcern.org website. Leave in the comments below any hints and tips that have really worked in managing your sleep symptoms. It might help others watching this video. If there's any other topics that you'd like me to cover, then also leave that in the comments as well.